Types of fibroids. Intramural fibroids are common and develop within the muscular wall of the uterus. These fibroids may grow larger and can stretch uterus. These can cause heavy periods. Submucosal fibroids are located beneath the lining of the uterine wall, endometrium. They also can be pedunculated, which means that the fibroid has a stalk or stem that attaches to the uterus. These types are not common. These can cause heavy bleeding. Subserosal fibroids grow on the outside of the uterus, serosa. These are the most common type. They can grow large and can cause pain because of its size. Pedunculated fibroids, they may grow both inside, pedunculated submucosal fibroid, and outside, pedunculated subserosal fibroid, the uterus. These fibroids are attached to the uterine wall by a stalk, called peduncle. Cervical fibroids are located in the wall of the cervix, which connects the uterus to the vagina. They are very rare. Factors that increase risk of fibroids. Age. After 30s, there are chances that fibroids become more common through menopause. After menopause, fibroids normally shrink. Family history. If a woman's mother had fibroids, then there is risk that she might have about 3 times higher than average. Overweight. Obesity. Overweight women are at great risk for fibroids. The risk is greater than average women. Some alternative names of fibroids. Leiomyoma, fibromyoma, myoma, uterine bleeding fibroids, vaginal bleeding fibroids, leiomyomata, fibromyomata. Diagnosis and tests. Uterine fibroids are found by chance during a pelvic exam. Heavy bleeding and other related symptoms may be considered fibroids as a part of the diagnosis. There are several tests that can be done to confirm fibroids and determine their size and location. These tests can include ultrasound, sonography or ultrasonography creates picture of uterus with sound waves. Doctor or technician places ultrasound device called transducer on abdomen. This is called transabdominal ultra sound, or the device is placed inside vagina, called transvaginal ultrasound. Doctor or technician checks if there are fibroids, where and how big they are. Computed tomography, CT scan. With this, several X-ray pictures are taken from different angles. It takes lot of pictures. A CT scan is painless and non-invasive. There is a debate as to the effectiveness of a CT scan when it comes to fibroid diagnosis. Magnetic resonance imaging, MRI, uses powerful magnets and radio waves to create a picture. This shows in detail the size, location of fibroids. It also can identify different types of tumors and help determine treatment options. Most often, an MRI is used in people with a larger uterus or in those who are nearing menopause, also called perimenopause. Hysteroscopy. Doctor inserts a small device or telescope with light attached through vagina and cervix and then moved into uterus. Then saline is injected into uterus, which expands uterine cavity and lets doctor to check the walls of uterus and fallopian tube opening. Hysterosalpingography, HSG. If doctor needs to see the uterine cavity and fallopian tubes are blocked, then hysterosalpingography is recommended. Doctor uses dye to highlight uterus and fallopian on an X-ray to check these area better. Hysterosonography. Doctor or technician pushes saline solution into uterine cavity so to expand the space inside uterus, uterine cavity. This helps doctor to see fibroids that are growing into uterus, submucosal fibroids, and the lining of uterus. This is useful if you are trying to get pregnant or have heavy periods. Lab tests. Doctor may recommend for blood tests if there is irregular menstrual bleeding or why there are fibroids. Complete blood count. CBC can help to check whether there is anemia, low levels of RBC, and other blood tests can help to check other bleeding disorders or thyroid problems. Endometrial biopsy removes a small piece of the lining of the uterus to check for cancer if there is unusual bleeding. To be continued. Thank you for watching my video. For more, kindly share and